The use of a shared mental model to reduce OR costs. This is Ariana Nasatka.
This is Clarissa Udespe.
This is Emily Vu.
And this is Emmy Weber.
The operating room accounts for a majority of hospitals' revenue and unfortunately for a lot of its expenses. One researcher found that over 50% of revenues and 25% of expenses were due to the operating room, which makes an opportunity for changes in process. Expenses of the OR could include time, error, or supplies. In addition to that, there's going to be at least 4 people within the OR during the operation, which makes the probability of wasted expenses even greater. Studies have found that the use of a shared mental model may reduce these costs. A shared mental model breaks down and organizes situations to improve communication and understanding amongst a team. Specifically, the team strategies and tools to enhance performance patient safety, which is also known as the team STEP model, places focus on facilitation, situational monitoring, mutual support, and communication. By introducing a standardized briefing and debriefing process, Team STEPS appears to offer secondary benefits to the patient care process that ultimately improve OR efficiency, patient safety, and patient satisfaction, according to Rothstein and Ravel. We propose using this model in order to cut costs within the OR. With our introduction, we have come to the research question: among perioperative team members, does the use of a Team STEPS approach compared to the current hospital approach reduce surgical costs? And below this, we have an example of the Team STEP model, which is from the American Hospital Association.
The implementation of the Team STEPS approach has been supported by evidence. The operation room is a high-stakes environment that is susceptible to ineffective cost management, as we have already outlined. According to Rothstein and Ravel, the Team STEPS approach is an approach that can be used to mitigate some of the costs associated with the OR setting in order to improve perioperative communication and minimize errors. The Team STEPS curriculum is based on 4 core competencies: leading teams, situation monitoring, mutual support, and communication. Various studies have been conducted on the effectiveness of the Team STEPS approach in the operating room setting. Though there have been studies that have demonstrated the effectiveness, the approach is not universally implemented. According to the American Hospital Association, teamwork training was associated with significant improvements in results on the hospital survey and patient safety culture. Furthermore, according to the AHA, teamwork training resulted in improved health outcomes, with one study showing a 60% reduction in patient falls. Moreover, a study conducted by Parker in 2019 demonstrated that the Team STEPS approach showed marked improvement in communication, decrease in clinical error rates, and improvement in patient satisfaction.
Recommendations. So we have 3 recommendations, one for the perioperative phase, one for the operative phase, and one for OR general. For the perioperative phase, we suggested preoperative process. We believe that evaluating the patient's operability adequately is extremely important. Pre-anesthesia testing can help with minimizing unexpected case delays, and our cancellations. In addition, reminders such as phone call confirmations regarding case time and our required hospital arrival time a day prior to operation day can also help with reducing the case delays. For the operative phase, we recommend having case cards and preference cards. The use of standardized equipment for each procedure instead of a surgeon's individualized preferences helps to reduce both cost and time wasted. And lastly, for OR management, formal studies have validated the need for efficient room management. This allows for the constant reevaluation and modification in a minute-to-minute schedule. Additionally, it will allow for one person to control the scheduling of delayed, prolonged, or additional cases, which will inherently benefit OR efficiency.
Implications for future practice. After the 4 of us conducted research on this topic, we determined that the use of a Team STEPS approach compared to current hospital approaches is in fact beneficial in improving OR efficiency and reducing surgical costs. This finding then means that unplanned and unnecessary surgical costs can be reduced hospital-wide by implementing this approach. The approach introduces diligent and standardized communication techniques to assist healthcare staff throughout their practice in the OR.